Hi folks, this is Hariom for CBNR. Today we are going to see a very small topic of causal relation. Even though I'm not going to talk much about the how to find out causal relation and things like that, I'm going to talk about only one thing, causal relation, and its relation to low backache. Right now, as I've already said that there are certain evolutionary biological ideas which are useful for us in understanding our patients. So I'm going to talk today about how this causal relation is valuable in understanding our patients, especially in case of low back pain. Right now, one of the common things I suppose we all encounter is low back pain, and I'm going to see how this plays out in relation to causal relation. Causal relation. Now, in a simplistic manner, if I say a causal relation means that A causes B, right? One factor or one element causes another. Now, one of the easiest thing we can all remember is you have a mosquito bite after a particular time, right? You you get sick, you get malaria, you also get Zika virus, I suppose, at this point of time. So what is the value of this in terms of evolutionary biology? We can learn that if there is a lot of bug bites like mosquitoes, my chances of dying are greater, so I will try to avoid it. This is not just just particular to human beings. It is also for all animal kingdoms, right? If you see a colored frog, right, a bright colored frog, all the snakes will avoid it because evolutionarily they have learned that this is A and this causes B, that is death, right? They get sick and they die, right? This is the story I was talking about when I was in an earlier video. We were talking about how I go and collect mushrooms, and that mushrooms leads to diarrhea or death, and then I avoid that mushroom altogether. So a causal relation is always vital for that, and we are always seeking those patterns. As I told you, the animals also seek those patterns, and the common example are the bright-colored frogs. Right. So what is the value of it? As I told you, it is in the prevention of it. Right? We can understand how not to get malaria and how not to die. So the biggest problem with this way of in terms of understanding causal relation, not exactly from the point of science, that is if you are doing it with common sense, if you will, right? One of the easiest examples I can say is they always tell you that don't eat ice cream, you will get cold, right? You will get sick and things like that. The problem is we know that it is not always true. It's a far more complicated thing. Four of you go and eat ice cream and only one person gets cold. Um, there are hundreds of factors to say that this may not be true, right? This also happens in other natural biology also, if you will. You can see that a lot of snakes mimic true, even though they are not poisonous, they try to mimic it as a form of survival, right? So what I'm trying to say is there are a lot of false causal relation you can formulate for yourself, whether you are a predatory animal or you are a evil animal like a human being, right? We can all form these false correlations, right? Right. So what does it mean, right? It means that we make false correlations in many situations, and when it comes to science, right? Um, the problem with the scientist, if you will, is the first thing they tell you is we don't know, right? They will tell you that no, this is not the relation. But what is then you will ask, then what causes this problem? And they were like, I don't know, right? This causes so much of problem in our head, and to the human apes as such, right? This is a huge conundrum for us. It looks like we are dying, or our head is exploding and things like that. Why is this? Why do we want to know what caused this? We are um, such a curious animal. We want to know, we want to know, we want to know what the causes this, what causes this, what causes this, right? Right. So if somebody comes and tells you we really don't know, what we do is we start to make up reasons. That is, we form this ridiculous ideas of this causes that, all sorts of things. Say, for example, if you watch television for a long time, your eyes will go off, right? As though if you don't watch television, your eyes are opening, but it is resting, right? This kind of things we keep on formulating. A lot of people tell you that if you eat potatoes, you get gas. And if you think about it, where is this gas going to go and stay, right? You can get it, I'm not denying that, but they think that the gas is here, the so-called Viber, if you are in Tamil. So we make up these stuffs, right? What is the reason we make up these reasons, right? That is one thing we want to understand, right? Right, because we make up these stuffs primarily because we want to live, right? If we know the reason why we are getting it, then only we can prevent it. So evolutionarily, this is a big need for us. Even Valluvar said that knowing mudal nadi, we have to treat it to the finding out the exact reason, which is not possible at all at Walluva's time. That was probably 2000 years ago. Now also it is not possible at all, right? Most of the time it may not be possible. But we like to make up these stuffs primarily because there is a evolutionary need for us to stop dying and stop preventing from hurting ourselves, that kind of thing, right? So the common example is how to prevent ourselves from get mosquito bites. We put a screen throughout our windows, in our bed, all sorts of use repellents and things like that, so that we are not dying. Now, if I apply the whole thing in non-specific back pain, this becomes slightly clearer for us to understand why we need this. Now, the first thing you want to remember is, why do they call it as non-specific back pain? Because the answer is fairly simple. We don't know the specific reason, right? We really don't know. When I tell this to the patient, they are like, "Oh, this really?" And they are like surprised. And the common example I tell them is, "Do you know why you get a headache?" We don't, right? But we know that that's not going to kill us, so we have sort of calmed ourselves and we don't catastrophize those things. But if it is back pain, because of the social media and poorly educated people, we have made up this idea that back pain is bad, it is next to cancer. If you don't see a physiotherapist, you will die. All sorts of things. If you don't put traction, then your orthopedician will die, right? All sorts of things we make up. That's what I mean by we make up, right? So we come up with these correlations, right? We correlate, why did I get back pain? Why do you get back pain? Because you're riding too much, because there is a problem in your posture, the alignment is wrong, the muscles are long, the muscles are short, the muscles are weak, all sorts of things we make up. Remember, none of it is true. If somebody is telling that they are true, that means they are poorly educated. And our patient also make up some stuff. As I told you, a lot of patients say that, is this vibe, right? Is it because of gas? Do I have back pain? I worked yesterday very hard. That's why I got back pain. I traveled. I got back pain. I did not do the exercise you told me, which is very important. I got that. So all these things We all make up these things. We all make up this correlation, right? But remember, these are all correlations. These are not causal relations. If you don't know the difference between correlation and causal relation, we will do that later on. This is not. This video is not about that particular. That is why our patients keep on asking us, I did this. That's why I got a pain today. Is it true? I didn't wear my collar. That's why I got pain today. So they are always asking us this question: is this the reason? Is this the reason? Is this the reason? Right? So what is the what do I do if I'm a clinician and if they are asking, keep on asking that, is this the reason? Is this the reason? Don't be afraid to say, I don't know, right? One of the great things about science is saying, I don't know or I'm not sure, right? You can also say that probably they are risk factors. It's probably working long hours might be a risk factor. Don't think it as a exact reason. And you can also say that you can give analogs. Say, for example, we don't know why you get what is the etiology of Parkinson's. We don't know what's the etiology of diabetes. We don't know the etiology of headache. So we can give so much of analogs to saying that it is not just in a back pain. In a lot of conditions, we don't know the reason why you get back pain. But what we know very well is how to manage it. Right? We know very well how to manage diabetes, but we don't know why you get it. Probably some genetic reasons, but we are not very sure. That is how we need to talk. Okay. You ask me what happens if I give them or if I make them believe that these are the reasons, right? That is on riding bike, posture, alignment, all these things. This is where our patients become worried. They catastrophize the pain. They may get into chronicity. And most of our physiotherapists and medical professionals are poorly educated because they make up stuff like this, and that stops evolution of our science. Understanding it, how to prevent it, all these things are uh, we are stopping it because we think that we already know. If we don't know, then only we will think of finding answers for that. We already think we know all these things, right? A lot of people think you are talking as though you know everything, and they come and tell us that these are the reasons for back pain. I keep on telling them I don't know. A lot of people are offended when I tell them that I don't know, whether it's physiotherapists or medical professionals or patients. Don't worry, that is the first step in science. If you don't know, then you find an answer. If you already know, it is difficult. But remember, at the same time, the patient needs it. He needs an answer. So learn how to convince them. Right? There are many methods for it. I'm not getting into that. But that is vital for them to be satisfied that evolutionary need. Right? Thank you so much for seeing or watching our video. And to watch our similar videos like this, please subscribe to my channel. Thank you very much. Bye bye.